Hi, Mary Jane.
Hi, Michael.
Tell me about Therapeutic Touch.
Therapeutic touch is an energy healing modality. It's something that I learned nearly 20 years ago. And I was quite amazed with the feeling that I had as I learned it and was introduced to it the very first time. And also the effect that it had on the people that, in doing an exchange with other people that were doing it, I clearly had a sense of energy within my hands as I was going over the periphery of a person's body, not touching, keeping my hands 3 or 4 inches away from the body. And that sensation would change in the course of the 3 or 4 minutes that we were practicing with each other. You could at once feel ripples, or you could feel pricklies, or you could feel heat or coolness. And the person that was receiving the feeling, not touching the body, but just skimming over the surface, could also feel sensations. And if you stayed with it long enough, stroking over the body part, the arm, the head, the leg, wherever you were doing your work, the person would have a sense of relaxation about them. And you could, within a few minutes, you could hear a sigh. Their breath would change. It would deepen. It would slow down if it was rapid. And you could clearly have a feeling of the person's relaxation with their sighs and letting down. So I pursued the course of study to learn Therapeutic Touch so that I could use it professionally as a nurse. And found out that Therapeutic Touch was created for nurses to use in a professional environment by a nurse and a person who was very skilled and sensitive to energy. And they created this modality at New York University in about 1972. And as I pursued the course of study, I used it with my hospice nurses with incredible effect to relaxation. And when a patient was more relaxed, there was less anxiety, less fear associated with their dying process. Found that they needed to use less opioids or pain medication for pain when they were able to relax or to breathe more deeply and more easily. And the element about it that was so surprising to me, and for which I was very grateful, that there was a sense of ease and peace for these people that received Therapeutic Touch. And in the course of serving these patients and their families, I would teach their caregiver how to do Therapeutic Touch to ease anxiety or pain or nausea. And invariably, the caregiver would feel more relaxed, more at ease, and more peaceful with their loved one and the dying process. And it seemed like to me that Therapeutic Touch was a very valuable asset in a person's transition in the dying process, and the families being able to be with that person and to exchange love and care.
Thank you. We'll come back to that.